Hello, my name is Theresa Patton, and today I'll be sharing findings from my study titled The Impact of Race on Healthcare Coverage for Women in Louisiana and Mississippi. This research is co-authored by Dr. Juritsa and Dr. Nizam Najd. The research examines how policy decisions, specifically Medicaid expansion, under the Affordable Care Act, shape insurance coverage for women with a focus on race and geography. You might ask yourself why this study matters. Black women are 2 to 3 times more likely to die from pregnancy-related causes, and over 27 million Americans remain uninsured at the time of this study. Health insurance is a critical gateway to preventive care and also primary care. While the Affordable Care Act expanded coverage, those gains were not evenly distributed across states or populations. The ACA included Medicaid expansion. The Affordable Care Act aimed to expand insurance coverage, improve affordability, and eliminate cost barriers to preventive care. Medicaid expansion became optional for states after the Supreme Court overruled the decision. Louisiana chose to expand Medicaid, while Mississippi did not, creating 2 distinct policy environments in 2 neighboring states. This quantitative study examines the impact of the Affordable Care Act and Medicaid expansion on health insurance coverage. Specifically, it assesses whether race impacts coverage for Black women and white women in 2 states, Louisiana and Mississippi. This study uses a quantitative quasi-experimental design with data from the American Community Survey, years 2010 and 2021. The sample included approximately 2,060 Black and white women, ages 19 to 64, excluding children and those that could qualify for Medicare, with incomes at or below 138% of the federal poverty level, which is the amount required for Medicaid expansion. Chi-square tests were used to assess relationships between race and insurance coverage. In Louisiana, Medicaid expansion led to 72.5% of Black women being covered by Medicaid, and the uninsured rate dropped from 44% to 11%. However, in Mississippi, only 46.4% of Black women were covered by Medicaid, and the uninsured rate remained high at 27%. Although coverage improved overall, there are still racial disparities. Race and geography continue to shape access to insurance, even in expansion states. So in conclusion, Medicaid expansion significantly improved coverage for Black women in Louisiana, while gains in Mississippi were smaller without expansion. Race and geography still influence insurance access. Where you live should not determine your access to affordable health care.